Um, I would just prefer just to let Ellen go right ahead and begin.
So if I've already written a letter on somebody else's petition, can I do this one too? They don't say, oh, we've heard from this person before. They're no, okay, good. In that case, click to play.
Okay. That I would like to respect everyone's time. So please, Rana, go right ahead and let's start.
Oh, yeah. So I think everyone here already knows Ellen, but she's the executive director of Connecticut Health Policy Project and has been for many decades, actually. And Connecticut Health Policy Project is a consumer advocacy nonprofit working to expand access to high quality, affordable health care for everyone in Connecticut. And we asked her to come back because about 6 months ago, she gave a demo of a website in progress and asked for input. And it went live a couple of weeks ago. So I, for one, wanted to see it and thought others would as well. So thank you, Ellen.
Sure, I would be happy to. I guess I don't know if everybody was on when I did the, sort of, it wasn't a demo because we didn't have a live piece to show. So now we do. Oh, Liz has come on. Would you like me to pause or no, keep going? Okay. So healthcare is complicated and there's a lot of misinformation out there, a lot. And people are, some of it's probably deliberate. Well, some of it's definitely deliberate, and misnaming things to get, to get something passed that, by misrepresenting. But some of it is honest. People just don't have a good source for balanced information. That was really important to us, that this be balanced. So I have equally delighted and angered people with what we put out, which is all good. But so it's cthealthexplained.org. We call it CT Healthcare Explained. And we have 17 different topics. I will show them to you. Actually, I can start that now if you let me share this screen. And anyway, we are, it is separate from the Connecticut Health Policy Project, partly so that you can search it easily, but also because CT Health Care Explained does not take positions on issues, and the Connecticut Health Policy Project definitely does. So it is a separate project, and it's not just me. I will bring up the team who helped me. I need to do that for sure. And why is it not showing on my, oh, this is annoying.
It's not sharing, but we did make you a co-host.
Oh, okay. Because the home box is there. I don't know why it's not working to let me show it.
Are you sharing?
I was trying to, but it's not working.
Would it help if one of us brought it up, although we would have to just take your orders?
Hold on. Let me see. Now it's completely different. Actually, my Zoom has gotten really weird. I don't even see a place to,
Ooh.
I don't know what's happened here. This is not good. I can't demo something. Maybe you should let Liz go and I will try to figure this out.
Okay, thank you, Ellen.
I may have to come back in just to reset.
So Liz is here to talk to us today from Connecticut Citizens Action Group. She is the Associate Director, and take it away, Liz, when you're available. I'm sorry, mid-sip.
Thank you so much. It was Holly invited me to speak to this about like an hour ago, and I was like, yes, absolutely. So it's great to see many of you, and it's great to meet some of you. My apologies for being late and for not being able to stay for more of this meeting, but it is great to be with you all. So CCAG, as you guys may or may not know, And also, I'm super interested. I'm going to have to jump, but I want to hear Ellen's presentation too, and the website. So as you guys may or may not know, CCAG, who here remembers the public option fight in 2021 and in years prior to that? Yeah, so a lot of us, yeah. So cool, thank you, Holly. So CCAG in 2021, after there were 5 health insurance companies that wrote a letter to Governor Lamont, and basically it was an extortion letter, and those companies said, we're going to leave the state, we're going to take our jobs, and leave the state if you pass a public option. And very sadly, it worked. So, and, we did not get a public option, and, now the situation is different. So we didn't, there was no movement for a public option last year, and that's really not on the horizon. But we're continuing the fight, and what the form it's taking right now is we've been reporting on, basically it's for-profit healthcare, and the for-profit insurance companies are just extracting billions of dollars from our care into profits and stock buyback and executive compensation. And this is something that's been known, but we're really calling it out and pushing it out. We have done a couple of reports over the years, and we're coming out with another report in early August. The total that we found, even just 4 of the health insurance companies that signed the letter to Governor Lamont, these 4 companies took home in 2022 $400 billion in executive compensation, stock buybacks, and profits. So these numbers are just absolutely shocking. And now they are in the process of requesting that the state insurance department grant them permission to raise their rates again. And, it varies a little bit by company. Yeah, and so it varies by company. The insurance department, let's be honest, this is an administrative process. They probably will be granted some of the increases that they're asking, because what the insurance department has done is typically used actuarial criteria, right? So we've started a letter campaign, which you guys are now a co-host of, where we're asking people to write to the insurance commissioner and ask him to take into account these other figures, the profits and the compensation and the stock buybacks, in granting the increases or not. There's going to be a public hearing in August, and people will have the opportunity to comment, and we're going to have a press conference and some activity outside of that hearing. Even we want to carry this beyond the hearing, though. We're looking ahead to the session next year. We're looking to some of the things that other states have done. We're looking at getting an association together of some of the folks that worked on the public option, and we'd like to be in touch with all of you about continuing this fight, because it's just obscene, and the call is very clear. No lawmaker. We're looking at all the tools in the toolkit, right? This is just it's just disgusting. And Bloomfield, Cigna is based in Bloomfield, so we started today. We're doing a series of social media posts, and this week is Cigna week, and then next week is going to be Anthem. There's going to be a United Health Group, and there's going to be a CVS week, and we have a series of posts. If you want to just visit, it's our website is ccag.net, and all of our social media channels are on there. I won't, if Ellen, I'm not going to think that I could share my screen when Ellen couldn't. But so we're rolling it out one at a time, and we're going to also post some explainer videos as to what is a stock buyback, right? Many people credit/blame stock buybacks for causing the depression. It's a way to manipulate the stock prices for people that are already insanely wealthy, and there's billions of dollars being spent. So this is a big part of what's wrong with our healthcare system. We think enough people have stories to tell about their claims that have been denied. Thank you, Holly. Right, their claims that have been denied, and when we door knock on this, if your health insurance company is Cigna, we can say, well, geez, your CEO made $37 million last year, and that was down from $91 million the year before. How is that okay, right? So we're asking everybody to help share the campaign. There's an Action Network letter campaign. And we're gonna keep at it. So yeah, any questions or thoughts?
In the chat, Donna would like to know if you have a date set in August for the hearing yet.
I expect to hear that this week. Not yet.
Okay.
Not yet. We also have one of our members wants to know who exactly is making the decision. And so I've asked the insurance department that, is it like an individual? Is it, I think it's an administrative thing, but she wants names. So, well, that could be the insurance committee soon enough. Yeah. And last year was an improvement. Typically, as I understand, these have been at the insurance department and they've been pretty dry affairs. Last year, it was at the LOB. And so there was like the Zoom capability, and we're hoping that that's the case again. We'll certainly urge that. And yeah, so the Zoom, that's one good thing from COVID, people can still testify remotely. Patricia, you have a question?
Do we know which of the politicians are on our side?
I think that's a process that we're going to start to go through. I mean, and I'm sure we'll be talking to you. We had a list of champions from the last time. We had a list of people who were bad the last time.
Also good to know.
Yeah, we'll definitely be digging into that. Yeah.
Thank you.
Cool. So, well, it's kind of thanks for anything you guys can do to help, help blast it around and help reinforce it. Really appreciate it. If it's okay, I'll sit and listen to Ellen for a little while too.
Of course, you're always welcome. You all good now, Ellen?
Yeah, I think so. Let me see. It looks like, well, we'll try. Are you seeing it now? Oh, good. All right. All righty. So this is the website. It is cthealthexplained.org or .com. I bought both. And it's meant for a wide number of audiences. So I want to share with you who we are. There we are. So it was put together by a team. I was on it, but Haley Magneta is a PA who works with us. She works in an emergency room in a hospital in Connecticut. Stephanie Gennaro is one of my former students. She's graduated. She has a DNP now. Scott Shear is a consultant who does consulting for businesses who want to help their employees get access to the care that they're paying for. And Chizoro Taylor is she's a PhD candidate in GW and also runs three services at Yale New Haven. She used to just do one, but they've been cutting back. We're not sure why they're cutting back on clinical, but that's what they're doing. We have an advisory committee that includes a ton of people. Sivan was on there for Medicare for All. Holly's on there. Sheldon's on there. Lots of great people. We also had, people people who chose not to remain anonymous, but from, we had CBIA on there actually. Wyatt allowed me to put his name on. We had people from the insurance industry and from hospitals as well. So I was very open. So we have 17 topics. It's for people at all levels of familiarity with health policy. So we asked people what their questions were, what sort of your general questions are. And we got things like, how are people covered? What's being tried to fix healthcare? Why do prescription drugs cost so much? Why does healthcare cost so much? Who decides benefits covered and costs, and is healthcare fair? Those are just the first 6 we did, and these are videos. Maybe I'll bring up Chizoro's here. And why isn't it coming up? Anyway, if eventually, maybe Northampton's internet isn't working real well right now either. But anyway, a YouTube video explainer comes up that describes the answers to that question. Why do there we go. Prescription drugs cost so much in Connecticut. This is Chizoro's, Chizoro narrated this one. But you can see there's a bunch of different questions, and we're going to be adding more. And at the bottom of every page, there is, how are we doing? If you have any other questions or want us to tell us what we can do better, what other topics you'd like us to do, please let us know. Something I want to remember to say too is you can sign up for our email. This is the email for the CT Health Policy Project. So you will get, my blogs and other things as well, but you will find out when there are updates. And this summer, every Sunday, you will get a Connecticut health policy minute. It's a short explainer. Last Sunday's was why is healthcare so expensive, that I promise only takes a minute to read. I timed it and I looked it up, how many words a person can read in a minute. So they're all under a minute. And it's just a simple blurb to get people to understand about the different topics. So that's the video explainers. If you want just the basics, like a summary of things, you can go to the basics page. And here you'll find, say for Medicaid, there are 17 different topics: hospitals, healthcare consolidation, workforce, evidence in healthcare. That's one of my favorites. God forbid we should base policy on evidence. Public health and patient rights. This was real important to people to understand what their rights are under the law. Connecticut hospitals, quality. The quality of care in Connecticut is just average, and we're paying way above average prices. Prescription drugs, health equity, the Affordable Care Act, and healthcare reform. Healthcare coverage, how do people get coverage, private insurance and healthcare costs, Medicare, Medicaid, structure of the healthcare system. And I'll just try Medicaid. Here we go to the basics. Here we go, Medicaid basics. You see that just a very short summary of the basics of Medicaid in Connecticut. And if you want a deeper dive, you can go down, like for who qualifies, how is Medicaid different from Medicare? You can get all the questions under this over here, basics, who qualifies, and you can go, you can just skip down. Where does Medicaid's money go? And then you start seeing where the money goes, and it's mostly to hospitals. The change in state spending, the Medicaid state share has grown this much grew about 7% between 2014 and 2022. The general fund was over 20% growth, and the state employee medical also grew about 20%. So Medicaid is doing really well. Medicaid is not the reason that our budget is going up. And the federal share, the feds are giving us more money under Medicaid. Medicaid is a percent of state budgets. This is Connecticut versus all states. And this is across the years, and we've been considerably below as how much of the entire state budget goes to Medicaid. And this is, so you can go on to different questions. Is there, oh, you know what? I bet you all want to see the Medicare for all part. Let's see, deeper dive and go to, it's under reform. And something I should say again, I've said it, but I should say it, I don't say it often enough, is we're going to be adding healthcare reform, coverage, cost system, coverage reform. There we go. And universal healthcare proposals. And here is Medicare for all. What are the universal healthcare proposals at the federal level? So we will be adding more topics over time and could potentially promote subtopics up to topics if people wanted that. So what are the pros of universal healthcare and the potential cons if you take the position of others? And talks about the federal public option, the Medicare for all proposal, and how the US, how to move us toward that goal. So I don't know if there are any questions. That's kind of it. If you're, have I hit everything I wanted to? I think I have. Are there any questions?
That's awesome, Ellen. I want to send this out and get my people to, look around.
Cool. Very cool. It's yeah, I would like people's, and I want honest, feedback. I have gotten feedback from some people that it's not, progressive enough. Some people felt it wasn't, conservative enough. And so it was a balancing act, and the team made the decision with advice from the advisory committee on where we landed. So not everybody's going to love everything, promising that right at the beginning, but at least you'll have the information to make the, at least we won't be arguing over, the numbers. Did I lose everybody else? Is everybody listening?
Yeah, it's awesome.
Okay, good. Here you are.
I'm thinking I'm thinking of all the wonderful things that these 1-minute blurbs that you had talked about before could do for people who are doing testimonies.
Oh,
And
yeah.
getting back to like elevator speeches and things like that at the LOB, and being helpful for first-time people who aren't used to going to the LOB and things like that, and to get them a little more prepared. They would be very, very helpful. And that's what's been running through my mind. That's why I'm typing and I'm thinking at the same time.
Well,
So
good. I
it's-
like that. Actually, there's the 1-minute blurbs are just coming in emails to everybody, but I probably should put them together in one place because nobody's testifying over the summer when I'm sending these out. So, and I
Right,
don't know about you,
correct.
but
And that-
Microsoft seems to want to lose everything that's ever sent to me ever.
The
It's causing
Google Docs, Ellen,
problems.
Google Docs, Google Drive, they're your friends. I've learned. But yeah, seriously, I think it's a really, really amazing thing that could help a lot of us, and those of us who are teaching advocacy to others to pass on for future leadership. This would be really helpful, big time.
Yeah, we wanted it to be for, and I know this is like breaking every rule of communications is having different audiences, but when I was thinking about this, I was thinking about students that, that I teach, and also students who call me, like I have to write a paper on Medicaid in Connecticut, tell me everything you know. It's like, I don't know where to start. People who have come into a new job, new reporters. I was doing, climate change. Now all of a sudden I'm a healthcare reporter and I don't know where to start. Consultants who come into Connecticut and misrepresent things and say, didn't Google us, for instance, and they say things about, well, why don't you go to your Medicaid managed care plans, about that problem. It's like, yeah, because we don't have any anymore. So we have people, and then, just regular people who don't understand why is healthcare so expensive? Why are insurance premiums going up so much? And so it helps explain that there's plenty of reasons why it's going up and breaks it down. And hopefully it's useful. It's very, the reason I needed a team and a huge advisory committee is because, I've been doing this stuff, as Rana said, for decades, and I just don't understand why people don't understand. So I had to learn how to say it in a way, and that's the part I really need help with. So if you have ideas or thoughts on that, I'd really love to know.
I promise I will give honest feedback, 100%.
Thank you. Well, everybody's either too overwhelmed to ask a question or need to look at it a bit and come back.
I think it looks great. I look forward to scrolling through it myself. I just posted in the chat. Has anybody else been trying to scroll on the screen as Ellen?
It's scrolling. I'm sorry, what? That scrolling on the screen isn't working?
Yeah, like you're on my screen, so I'm trying to navigate to the things, which of course I can't because it's your screen, it's not my screen.
I get it. Yes, that I can't help you with. Sorry.
Tom has his hand up, Ellen.
Who does? Oh, go ahead.
Yeah, and if you just heard that big bang coming from my screen, that was my cat. It just knocked my big screen TV over.
Oh, that's a problem.
Well, it may be. I don't know. I'll find out in a minute. But anyway, no, this is fantastic stuff, Ellen. Thank you so much for creating this and organizing it. And yeah, I'll certainly be referring to it as well as referring others to it. I put in the chat, maybe you didn't see it because you've been, interacting with everyone, but I would love for you to come to our next public policy committee meeting for NAMI Connecticut and show this, because I think that would be really helpful to our members to understand that this level of detail is out there in a very comprehensive and digestible format.
Great. Yes, I'd be happy to. Especially
Wonderful.
since we can do Zoom now. I can do it even when I'm not sitting in front of a lake in Vermont.
Yeah, no, we do all our meetings on Zoom because we draw people from all over the state. It just makes more sense to do that.
Right.
So yeah, thank you so much. And I will send you the details on the next meeting. It won't be till August. It's typically the second Thursday of the month at 6:30. So if you want to put a placeholder in your calendar, but I'll send you the information. I don't know, are you on our listserv for that?
I don't know, but I should be.
All right, if you're not, I'll make sure you are.
Okay, great.
All
Thank
right,
you.
thank you so much.
Sure. And someone asked a question about why won't Medicaid for Medicare holders won't cover dental, vision, and hearing. That should probably go to Sheldon. I'd be surprised it doesn't.
Should I
I saw
answer that?
it in here.
It doesn't because I'm sure it doesn't because regular Medicare doesn't cover it, so they aren't going to cover it. The bums.
I didn't understand exactly the question. Say
The
it again.
question is, how come Medicaid for Medicare holders won't cover dental, vision, and hearing?
That's not true.
I didn't think so. Okay, thank you.
Medicaid covers anything that's covered by Medicaid that you can't get under Medicare when you're also on Medicare.
Are they on maybe?
So wait a minute,
Wimby's one of those?
Wouldn't be
okay,
that-
can I email you some questions, Sheldon?
Sure, you may.
What's your email?
I'll put in the chat, but unless you have to be careful. One has to be careful when using the term Medicaid because it means a lot of different things. And if you're talking about one of the very limited Medicare savings programs, then that's different. Medicare Save, which is technically a Medicaid program. The Medicare savings programs, all they are is cost sharing, filling in the holes of cost sharing under what's covered under Medicare. It doesn't cover additional things that are not covered under Medicare at all. That's the only kind of Medicaid.
Okay, so, all right, I'm gonna have to ask you some questions. So, I'm gonna have to find your email and find
Yeah,
some.
I'll set it in a second.
Thank you so much.
Yeah,
Cool.
I did have my hand raised though, otherwise.
Oh, okay. Sheldon has a question for me. We didn't
No,
get this
it's
2
a-
hours ago when you called.
No, actually, it's a comment, which is that this is a very impressive effort, and it's a very impressive effort, particularly coming from somebody who is a really strong advocate. Because what's really hard, I can't do this, what Ellen did. I can't do here's kind of like objective information to help you wherever you're coming from, whatever issues you care about. Here's some like background information to help you in figuring out what you want to do and learning more and whatever. Everything I write is slanted to advocate for whatever I want. So I could not have done this project, and I think it's a very impressive effort. Thank you.
It is, it was hard. And I don't know that I didn't veer off. If I did this with CBIA, I would clearly get a different perspective. And I'm a little bit scared to send it to them, but I haven't heard anything from them lately, so I think I'm good. But it is hard to have that in your head to give the other side. And I'm lucky that I have team members who keep me honest. So, Sarah wants to know, I'm not sure if someone could answer this, but would it be possible to increase the maximum income that would allow people to qualify for Husky to make it more accessible to middle-class people? Yes, it is absolutely possible. Absolutely. The legislature would have to do it and the governor would have to sign it. Also, it would be great if people who are self-employed could buy into Husky. Yeah, they tried that. It was Charter Oak. Now it was when we had managed care plans, but the problem was that it overwhelmed the system. They didn't price it properly. And we started losing providers from not only the public option, the Charter Oak plan, but also from from Husky. There were a lot of providers who jumped Husky at the time. Now, this was also when we had managed care organizations, so they were already halfway, had one foot out the door. And it started a death spiral, actually. So it has to be done really carefully. That's where the President Trump wasn't wrong that healthcare is complicated. It has to be done very carefully. It's something, you know, we could think about and talk about, but it would be, it would come with a lot of challenges. It's not real simple. I personally love Medicare for all. I really do.
I'll just jump in quick and yeah, I mean, Medicare for all is absolutely the goal. And thinking just in terms of being able to expand, you know, access as much as possible. So you mentioned a plan through Charter Oak, but just like simply like buying into Husky, like, you know, like, okay, it's Husky the way Husky is now. But you would just buy, you know, purchase it the way that, you know, I have to purchase, you know, I have an Anthem plan now. I had a different plan last year. So something like that, has something like that been tried, or is that possible, or
It's
at all on the
complicated
agenda?
because right now the state, we self-insure for Husky. So unlike your Anthem plan, Anthem isn't on the hook for, you know, if people cost more than they pay into the pool. You know, the state of Connecticut pays for everybody individually. So we'd have to make sure that, you know, frankly, insurers didn't dump a lot of expensive people into that plan. It is, so it has to be done with, you know, some guardrails around it to make sure that there isn't profit taking by a lot of people, not just the insurers, but the hospitals as well. They'll be looking for, they don't like the rates they get under Medicaid. And that's what happened with under Charter Oak is lots of providers, not just hospitals, but providers didn't like that they were going to get people coming in and they were going to get maybe half, you know, half as much as they did to care for them. And regardless of how you feel about, you know, which providers are overpaid and which ones are underpaid, it's something we would have to work on to make sure that it didn't end up in a death spiral again, and also didn't tank the underlying program, which is actually working really well. So I can see why, and it's a really attractive idea. And if we could do it thoughtfully, I think that I'd be open to it. I bet Sheldon has a position on this.
Well, that would be great. I mean, I'm a therapist and I accept Husky. I think they pay fine, but I don't know what other providers normally charge and get paid. But for my you know, for what I charge, they're paying fine.
But you're not a hospital.
Right, exactly. You know, and I live modestly, so.
Yeah.
Okay. Ellen, do you have anything else, or I want Rep Hughes to have a little bit of a wrap up time for us, if you don't mind.
Yeah,
That was
absolutely.
fantastic. Thank you guys so much. Ellen, that was fantastic work from you and your team. And like Sheldon said, I couldn't have done it without being biased to what I wanted people to think. So amazing, amazing job.
Well, thank you very much.
And Rep Hughes, thank you.
Yeah, thank you. Thank you. I'm blown away by this. I would say that healthcare in Connecticut and the US is deliberately complicated, is deliberately complex and not user-friendly for the sick patient to navigate. And that is all because it's based on a normalcy, a premise of for-profit healthcare system. And so once we start to deconstruct that, then we can stop normalizing it. You know, we can get maybe more public support around some of these policy solutions, because trying to keep the status quo afloat, I don't think is sustainable, and it shouldn't be sustainable. But alas, in the insurance capital of the world, Connecticut, that is what policymakers are basically charged with doing. So this year, our biggest fight in human services was expanding Husky for all who were income qualified, regardless of documentation status. We had a bill before human services that I really did not expect us to internally among the Democrats have so much opposition, but it was to expand Husky for all who qualified up to age 26. And it broke down in committee along the voting. And so what we passed out of committee was up to age 18 and then sent it to appropriations, although I really tried to get it to 21 because I felt, and I talked to a lot of my colleagues, I felt like politically it's really hard to just cover adults, but that there is a lot of public support for covering children. Of course, I thought that about universal free school lunches as well, and that didn't get funded either. So even though we've done some of these things, like during the pandemic, like universal free lunches, and funded that, and funded, basically Husky for all for COVID care and vaccinations and protections, we lost all public, I think, political and public will, to do what we know works and to do what we actually know how to execute. So what passed out of the appropriations budget was just funding to age 15, although it would grandfather in children who beyond 15 once they were eligible. And we also, though, put a study in there, an analysis that I'm really hoping we can get a robust study of not just how much it would cost to go to age 26 and then implement it once we get the results of the study, but what it would cost to actually cover Medicare for all. So we left the language that passed vague enough to possibly get that Medicare for all needs assessment, economic feasibility study in there. And I have talked to Deirdre Gifford, who's now Office of OHS Health Strategy and so forth, about how to implement that study and needs assessment. We also tried really hard to expand Husky C, and Sheldon can talk more about that. Again, the outside the building advocates and Will, and even some of our allies in positions of leadership in the committee was there, but we just had to, I guess, keep to the guardrails and offer a middle-class tax cut of a couple $100 instead of actually funding essential services for especially the disabled. So I'm bitterly disappointed about that, but we did put money in to cover Connecticut, so those who don't qualify for Husky because of their income, who are just above that in that sort of lower middle class, especially singles, can qualify for a premium free, like basically no premium, no deductible on Covered Connecticut. You have to go through the Access Health CT website to find out if you qualify for that, and you would get one of the two plans, and they have to be, I think, bronze or silver plans through Covered CT. Basically, it's just funding the insurance companies that are, through federal dollars that we get through 2025. So that helps get, I don't know how many, is it, another 40,000 people or something covered. So that's the 30,000 overview. Disappointing overview.
So I have a question. What do you think we can do to make what happened last session that was still actually, I'm shell shocked over, to be quite frank, that, we've always, and Tom has heard this, I know you've heard it too, Rep Hughes, we've always heard there's not any money. There's not any money. We can't do it. Well, we had the money. We have the money, and they still didn't do it.
Right.
not pointing fingers because it's both. So now what do you suggest that we do and how do we move forward? Are letter campaigns actually working? Do they matter? Do we need to change it up and make phone calls? And what do you suggest that we do to put the pressure on to make these necessary changes that people are dying because they didn't want to let go of the funds, which is ludicrous. And we all agree on this. But what do you propose that we do moving forward? Please.
Yeah, I think those are really great questions. Like you're asking basically, what did we learn, and strategically, what works. When the governor is all about like, let's relieve some medical debt. My question is, why the hell do we have medical debt in the first place? And then that got whittled down to, a little paltry amount, even if I don't know, is it 20 million or something, that I forget how much ended up, but this was going to be transformative, but again, not for a bunch of families that are burdened with ridiculous medical debt. But and that's great that the governor said, let's be one of the first in the countries to do this, to wipe out medical debt for 20,000 families or something. Let's do that. But how are we addressing the underlying ridiculousness, absurdity? The only country in the developed, world that accepts and normalizes this. And now, so there's been this cluster of PR around, well, you have to look at these hospital bills and so forth as a first offer in negotiation. Why should we have to do that? And not that you actually owe all that, or that's the be all. Why should we have to get a bill in the mail and become a negotiator? We have mediators for that are very, very well trained. There's collections agencies. It's like, are you kidding me? This is what we are asking, especially my elderly community, to navigate, that take their financial responsibility very, very seriously. And we never, address it this way. So I need the public to be as outraged as all of you are. And quite frankly, I'll just say it, I need white people to be as outraged about the people dying as a result of policy violence, as a result of discriminating against children because of their color of their skin or how they got there, whatever. It is violence that we allow in our name, and we say we can't afford it. And I know that, appropriations chairs were saying this very apologetically, but it's bullshit. Like it's bullshit. And I need a lot more outrage, and a lot more pressure. I mean, some people did feel the pressure. I really rallied like the freshman legislators to say, this is what you ran on, and do not succumb to the bullshit strong arming that's happening to legislators saying, and what about our veterans? What about this, or what about that? No, we are here on human services to advocate for expanding human services as a right to our constituents, to our public. And that was really distorted, and I think a lot of it's straight up racism, and a lot of it's criminalizing the poor, and a lot of it's like what went on with Husky C and Meg Connect was atrocious, and just the really buying into this very paternalistic, punitive view of people with the disabilities, that they shouldn't be allowed to be professionals working at the top of their scope of practice, that they should be dependent and infantilized by the state. So we got to organize. I don't know. Letter campaign, I mean, some of these people we just have to replace, and they're Democrats. But
Does anyone have any questions? And Rep Hughes, thank you so much for saying everything that you did, and everything that you did throughout the session was really appreciated. And I can't clap, snap, jump up and down enough because you're amazing. Go ahead, Patricia. Sorry.
I think Anne should write a letter based on everything she said, and we should all sign it. Because it was nice and passionate and everything, and it had all the right points, and it makes all the right points, and it has the emotion, and I think that if she has enough people signing it, it could make the newspapers, and then it could go bigger.
Well, I'll think about drafting it. I don't know. I do think, as co-chair of the Progressive Caucus, my job sometimes is to go get my white people and get them in line. But if I say that in public, they get very, very defensive.
Well, not everybody who looks pale is white. I don't identify as white, and I'm pale. But I just consider myself passing.
No, I
But
understand that.
I think that that's a great thing to do, to get that. And if you need help writing, I can help.
Yeah, well, I think it's time to I think it's time to create some outrage. I mean, the same thing, honestly, and this is so intersectional. In the final days of session, we can't go outside because the air is so thick with smoke, and we're in a climate crisis, and we did literally zero transformative legislation about meeting that crisis. We did a little band-aids, a little around the edges, but nothing, not even a modest roadmap of how are we going to, address our climate emissions goals. How are we going to reach them? Nothing. And it's the same kind of thing. Like, what are we doing here? What are we doing here? We delivered a modest tax cut and an earned income tax credit, but like, what are we doing with the sliver of time during an ongoing health and climate crisis? And we still, it's very intersectional, and I also believe it's intersectional with the crazy lack of affordable housing, which used up all of the oxygen in the room in the last couple of days, and certainly in the Senate for 12 hours last day. We got nothing passed. We got nothing substantial passed because everybody's all worried about affordable housing needs assessment and some renters protections, being the end of civilization as we know it, and home rule and land use and local control in Connecticut. So that is deliberate, by the way. That is deliberate. That's a playbook going across the country, even in trifecta states like ours. I just got off a call with a couple of other progressive legislators in progressive states with both Democratic super majorities in House, Senate, and same thing. It's all like crashing to a halt around, this boogeyman of land use and local control. And, people aren't able to really pass meaningful legislation that meets the moments and the real threats that are at our doorstep. Hey, Rana.
Okay, well, I'm really sympathetic about the land use thing. I'm on the Planning and Zoning Commission in New London, and it has been incredibly frustrating this last year. But back to this subject, as I was watching Ellen's presentation, and as I was going through that site, the section on Medicaid in Connecticut is really good in that it does kind of stand out as, wait, there is a way to make this work. And that's something we can build on. And knowing that my former Republican state senator, when I started talking to him about, Medicare for all, or, single payer healthcare in Connecticut, said, have you looked at the Republicans on saving money on drugs? We want to buy drugs from Canada, which totally misses the point. But I've gone to some local, PNHP meetings, and they're talking about, and Fall O'Connor is going to be reintroducing his state-based bill to make it easier for states to have, start out the process and have their own single payer program. Is working on that something that the Connecticut progressive legislators would find helpful?
Yeah, we definitely want to look at what other states are doing and if anybody has been able to roll out a successful, state plan. I mean, I agree. We have a pretty good Medicaid and Medicare oversight committee that really looks at those costs, looks at those metrics, looks at the administration. We keep our costs pretty low. We did elect Sean Scanlon as comptroller with the idea, okay, let's fix the state partnership plan this year and let's see how we can create a public option next session. But they have to be solvent. They can't be like, costing ridiculous amounts of money because, we can't sell it, right? So we definitely want to look at what other states are doing. And like Ellen said, we're a self-insured state. And so we're always looking to create that viability, sustainability balance. Yeah, I mean, there's lots of stuff introduced, but there's a lot of opposition, and I think the early part of the call about really exposing how much these CEOs are making while they're asking for, audaciously asking for rate hikes. It's the same with the energy companies, and we're trying to put in some guardrails to, but even the insurance company, they only have so much authority to recommend or deny within a certain range. So, and that's goes back to Ellen's thing. It's complicated. It's deliberately complicated, and we have normalized that and accepted that as a public way too easily, I think.
Yeah, I just if I can just add on to that, I agree completely. And I think we should definitely look at what other states are doing for sure. But I think we also have to look within Connecticut to what's raising premiums. And obviously, insurance companies are, nobody's worth that kind of money. And take off a zero and you're still not worth that kind of money. But the two biggest drivers of input costs to premiums, because the insurers can take 15 or 20% off of the number on top. So they're at least limited, but until this year, Shelley, they had reason to increase the base because 15% of a bigger number is a bigger number, right? And that's what's driving the base is the input costs, which is hospitals and drug companies, two groups that during COVID understandably had scientists and nurses who were absolute heroes. They came up with a vaccine. They kept people alive. They put their lives at risk. I teach nurses. I believe in that, but they're not the ones making the decisions about prices or where the money goes. And we have no idea how much money goes to administration and hospitals. Like I said, that Chizoro now is, on my team, and she's just actually joining my board of directors. She is running 3 different services. I think it's oncology, cardiology, and another one at Yale, maybe on orthopedics, because 2 other her colleagues have left. She used to just have orthopedics, I think it was. It's ridiculous. And they're making those cuts, but are they cutting any vice presidents of these multimillionaire vice presidents? And we cannot even find out how much they're spending on administration. It is really, but yet they're whining every day at the Capitol for more money. And I don't see, hospitals, my life was saved in a hospital. Many of us have those kinds of issues where obviously we need hospitals and we need drug manufacturers too, but we need them not to be gouging us. And unless they're going to explain where the money comes from. So I've actually been trying to talk to people about an MLR, medical loss, like a cap on administration for hospitals. But just to start with, figuring out where the money goes. I haven't been able to get an answer to that. And I've dug deep into OHS's numbers. I'm going to be digging deep into CMS case mix reporting this summer. That's my summer project. Very exciting. If anyone wants to steal it from me, you can have it. But it's complicated. As you know, as you said, it's complicated, and there's a lot of people making a lot of money, and it's whack-a-mole. If you push back on one, you know, another one comes up. So it's going to be, you know, my grandchildren will probably still be working on this if we don't get Medicare for all.
Thank you, Ellen and Rep Hughes. We are going to try to hopefully get a lot more things together. I'm going to try, well, Donna is doing third Thursdays in New London, I believe it is. So she's doing a lot of
Willimantic.
educating. I'm sorry, Willimantic, my apologies. She is doing a lot of education. And if anyone else would like to represent us and go out and talk to people and everything like that, fantastic. We would love that at, you know, your local farmers markets and things like that. That's how I was doing it. Just to pass out some brochures and trifolds that we do have. We can send those to you. We actually do have some swag back in stock too. I don't want to hold everyone, so I want to be respectful of time. So thank you all very much for coming. I did put all the things in the links in the chat for CCAG, for Ellen's website and everything else. So please move forward with those actions. They do matter. Please keep an eye out on our social medias. I'm trying my best to keep putting things in as best as I can. Pete, thank God, has been the one taking care of that when I'm not doing so well, but we're trying to do our best, and you know, we're sticking together with that. So please, oh no, stop, thank you. But we really do, you know, I want to try to make a bigger concerted effort, because last session was just way too disturbing for my taste. And we really need to push forward harder and harder, because, you know, people are dying, and it's gross and disgusting. And I'm tired of people who, as Patricia said earlier, who are pale or identify as white, whatever, are getting their damn feelings hurt. Get over it, move on, let's go, move. You know, those of us who are also disabled, and we're also marginalized, and it's gross and disgusting. So again, I thank you for all of your support and everything that you do. And please continue to follow us and, you know, help us out and just talk to people. Word of mouth is what will do it. And with all of these amazing minds and hearts and souls to keep pushing forward, we're going to do something, damn it, because I'm not going to give up. We have to do this. And Anne is amazing. She does this every day with all of her legislators. She does it every day. So if she can do it every day, we can try to do it. At least talk to one person every day. I mean, you know, so we need to be supportive of our reps and senators who support us, and give them whatever they need from us as well. They can't do all the work. So I just wanted to, again, thank you guys so much for all of the information. And let's please just keep doing what we can to move every inch forward that we can, until we do get the federal universal single payer healthcare, Medicare for all. We will do this, guys, I promise.
And we'll be ready when that day comes. We will
Yes.
be so ready in Connecticut.
Yes, we absolutely will. So thank you guys so much, and have an amazing rest of your evening. And thank you for staying over longer with us.
Thank
Take
you. And
care.
thank you, Holly. Thank you.
Thanks,
Thanks,
everyone.
everybody. Good night.
It was nice